Hello mommies and daddies, have you just had a baby and not sure how to look after their skin? Or you have a baby with very sensitive skin and you're not sure what to do with their skin after you've bathed them? Well, you have definitely clicked on the right video because this video I have made especially for you. I am Corinne Robinson, a pediatric nurse specialist and mom to 2 gorgeous boys. So in this video, I am going to be talking about 7 simple things that you can do at home to look after your baby's soft, delicate, sensitive skin. So let's jump right into it. So the first tip is to bath baby less often. You do not have to bath your baby every day, okay? And this might come as a relief to you because maybe your grandparents or your parents, your well-meaning friends and relatives are saying otherwise. But to protect your baby's sensitive skin, they don't need a daily bath, especially babies under 1 month old. In the first few weeks, your outer barrier or the top layer of baby's skin is very thin, still developing, and can be very sensitive, and it can easily dry out. Babies don't sweat as much as adults do. You do not have to bath baby every day. Okay, so you can use this between bath time. Use a soft, gentle washcloth and lukewarm water to keep their hands, face, and other parts of their body clean. Bathing your baby 2 or 3 times a week is fine until they start to crawl. Heat, sweat, milk, and sometimes even water can all have the potential to damage your baby's skin. The second tip is that the nappy area needs to be kept clean and dry. So we've all heard about the dreaded diaper rash, right? So leaving baby in a wet or dewy nappy for too long can irritate baby's sensitive skin, causing baby to have a diaper rash, or even worse, baby can also end up having a UTI. The bacteria from the poo or the urine get into your baby's bladder, so you want to avoid this at all costs. A nappy that's too small can also irritate their sensitive skin, so you need to be flexible and keep trying out different nappies until you find the perfect fit for your baby. In the first few days of your baby's life, your baby will need to be changed at least 10 times a day. Yes, you heard me. So tip number 3 is to keep an eye out for skin conditions. You need to be mindful of the rash that will go away on their own, and also the ones where you need to speak to the doctor. I'm really sorry to break this to you, but if you expect your baby to have perfect skin the first 6 months of life, you are in for a little bit of a surprise, because in reality your lovely baby is going to develop a rash, especially on the chin area, the nappy area, underneath the armpit, and anywhere that baby's skin is exposed to milk, sweat, urine, poop, on baby's skin where it is exposed to excessive moisture. You need to keep an eye out for common skin conditions: cradle cap, heat rash, contact dermatitis, baby eczema, baby acne. Yes, babies do get acne. It's very common in babies 2 to 4 weeks after birth. We call those tiny white bumps that appear on your baby's face. Babies can have milia after birth. Cradle cap is very common, and it's greasy looking rash on their forehead may not be a sign that your baby has sensitive skin. If your baby develops a rash, a small amount of the medicated recommended barrier cream onto the affected rash. Do not rub the area in the meantime to prevent those nasty rashes from happening. Always keep baby clean and dry, which will ensure that you look after your baby's sensitive skin and keep them happy and healthy as they grow. Tip number 4. Some babies can develop a rash after contact with certain ingredients, so it's best to limit their contact with strong dyes or strong fragrances. Professionals say avoid strong laundry detergents, use hypoallergenic laundry soap, stick to the best practice for bathing your baby. Maybe wondering, what should you put in the water? What should you put in your baby's bath water? You should use dye-free, unscented wash or bath soap in your baby's bath water. Dressing baby is more than just fashion. So here you need to think about what type of clothes that you are allowing your baby to wear. You need to consider clothes that are soft and comfortable on your baby's sensitive skin. Choose clothes that are made from natural fibers, cotton or linen, which are soft, breathable. Those cute knitted woolly cardigans, woolly jumpers, woolly hats can look super cute. Although they can look very cute, but they can also irritate your baby's already sensitive skin. So if you can, natural fabrics only, but no wool. So some babies often find the feel of wool on their skin stressful and irritating. It can also be quite itchy for your baby. Your baby clothes well can help to protect baby from the chemical irritants that can often be found in factories, and this can settle on your baby's clothes, and this can further irritate your baby's skin or cause an already existing skin rash to flare up. Do you always remember to remove those itchy tags? Is the final tip for you to help you to look after baby's sensitive skin. I'm saying this because baby's skin can become easily irritated by clothing tags. Also, where possible, it helps to buy clothes with any tags at all. What to do with their skin after you've bathed them? So there are lots of different baby lotion, baby cream, baby moisturizer on the market. So you need to choose the one that's best for your baby. It's a good practice to read the labels of these moisturizers. Always read the labels of these lotions to make sure that they don't contain any harmful ingredients that can further irritate your baby's skin. Best to use unscented, dye-free moisturizer on your baby's skin. Apply these to baby's wet skin, as this will help baby to absorb the moisture even more. So much for choosing to watch this video, and if you get any value at all from my video, subscribe and do help me reach 500 subscribers.